Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. I am happy to welcome Dr. James Greenblatt, a leading force in the field of functional psychiatry and integrative medicine, with extensive experience in treating complex mood and eating disorders. Welcome, Dr. Greenblatt, to the 27th Annual Spring Congress here in Orlando.
It's good to be part of the conference. Thank you.
Thank you so much. So let's dive into a bit of your content here at the Congress. Your lecture is titled Matter for the Mind, Exploring the Uses of Nutritional Lithium for Neurodegenerative Illness and Cancer. So let's start on a broad scope. What role does lithium play in mental well-being?
Well, lithium is one of the most important pharmaceutical drugs we have in psychiatry for bipolar illness. But what is not as commonly known is lithium is a mineral. It's in the soil, it's in the earth, and it's essential for well-being. So part of what I wanted to discuss is that low-dose lithium, the amount that you can get in a nutritional supplement, can have very significant effects on the brain and the prevention of disorders like Alzheimer's and like cancer.
So let's maybe backtrack a bit to your path in medicine. You know, you're a bit of a pioneer in the integrative medicine space and psychiatry. What was your inspiration? What pivoted you to that pathway?
Well, I think I went to medical school interested in nutrition and brain function. I might have been a few years ahead of my time. This was 40 years ago, but eventually I think the community has caught up. So I've always been interested in nutrition and brain function. And as a child psychiatrist coming out in practice, the only alternatives were medication for young children with ADHD. And that's where I started developing protocols and understanding the role of nutrition in those disorders for children.
The comprehensive psychiatric resources, your outpatient clinic.
That's been my private practice over the years for almost 30 years now.
So if you could describe a bit of your integrative psychiatry approach framework, how would you put that maybe to the new integrative practitioner?
It is a functional medicine model, and that's why we call it integrative psychiatry, but we're looking at the underlying cause. So we can take any major psychiatric illness, ADHD or depression, and even though the symptoms might be the same, if we take a hyperactive 12-year-old, there might be different underlying causes. So our practice would be looking at laboratory tests to try to understand, does that child with hyperactivity have a deficiency of magnesium, or is there an excess of copper? And same for depression, anxiety, even schizophrenia. So the real goal of our work is trying to look at the root cause, which is the core concepts in functional medicine.
So that's, I guess, an idea of biochemical individuality? Would that be a
absolutely,
semantic?
that's my favorite word, term. I use it all the time, and I think if we don't appreciate that, or our clinicians don't appreciate it, then it's really very hard to treat major mental illness.
So traditional medicine really focused on symptom-based, and psychiatry, maybe in the cultural landscape, has a bit of that connotation. Why do you think that particular specialty was so focused? Was there so much development, industry interest?
Well, in psychiatry, we had no other tools. We had no objective tests. If you went to your doctor, with a headache, they could do a CAT scan, a brain tumor, to look at what might be going on. For psychiatry, we have no objective tools. So we're just asking patients a lot of questions and then making these educated guesses based on symptoms. So the whole field of traditional psychiatry is this symptomatic-based model, and we're just prescribing medicine based on symptoms, not looking at causes.
Let's delve into a little bit of a specific therapeutic area, ADHD, which is the topic of your recently published book, Finally Focused, the breakthrough natural treatment plan for ADHD that restores attention, minimizes hyperactivity, and helps eliminate drug side effects. Could you share a little bit about these root causes of ADHD and some insight into your book and what that research is telling you?
Sure. Some of the research has been around for 20 years. People just haven't been aware of it. Some of it is newer. But we kind of use the subtitle, the plus-minus plan. So we're helping parents and physicians understand that the plus means there are nutrients that someone might need. So there are deficiency states that contribute to ADHD, and that is typically things like magnesium, zinc, sometimes the nutritional element lithium. And then the minus are things that might be getting in the way in terms of minerals, like too much copper, too much lead. And so helping in a kind of easy way for parents and professionals to be able to understand what might be contributing and tools to look for those.
Copper and lead, any suspicions or evidence that you can see as far as what's maybe in diet or environment that's...
Well, the copper-lead story is quite significant, certainly in the Flint, Michigan crisis, where lead toxicity was rampant, and the effects on brain function has been documented for years, and it'll affect these kids for many years to come. What wasn't part of the Flint studies, but more schools around the country, and certainly in my area in Massachusetts, the elementary schools started looking at copper and lead in the water fountains of these elementary schools, and high copper was common in the majority.
Right.
And
the copper fountains were, yeah.
Yeah, and we know high copper contributes to low zinc, and there's very good research looking at zinc deficiency and ADHD.
Any takeaways or maybe practicals you can leave with our listeners regarding ADHD in children? How can we better protect them?
I think there's so many variables, and it's that kind of balancing the lifestyle with the chemistry or the biochemistry. So I think the biochemical individuality is a great place to start. Respecting the ADHD symptoms. You're not going to cure all the symptoms, and you need to help adapt to what your child is, their strengths, and understand their weaknesses. But a good functional medicine approach can look at things like food allergies, gut dysbiosis, mineral deficiencies, and then you can balance that with, supporting a healthy diet. And some of the more newer research is on mindfulness and ADHD. So you think of a hyperactive child not being able to sit still, but you can do mindful exercises, which has shown to improve attention.
Amazing. So if we think about the educational system, right?
Right.
Implementing mindfulness time, would that be something?
That would be incredible.
Yeah.
Both mindfulness and actually walks in nature.
Right.
It increases attention and focusing. So there are lots of things we can do. Parents and people, focus on the games and the computer time. And I think there are good reasons to limit it, but it's not the cause.
Okay.
Except for in the young infants, it is a major problem.
Yeah, that really pivots to our next question a bit. Mental health, awareness, and wellness in the modern age, a lot on the impact of social media and technology. What are the changes that you've seen?
Well, it's pretty dramatic, and I've used the term social media is the gasoline, on this fire of mental illness. And a lot of my work is with eating disorders, young women with anorexia, and their social media is malignant and deadly, where it just perpetuates the illness. But depression, suicide, social media has been a very destructive force for many of these kids. There's also some very good tools that, like suicide prevention hotlines, are now reaching out using Twitter and tweets and texting. So, like everything, there's a balance.
It's a balanced approach.
But not being aware of your child's social media activity has been a significant problem for those suffering from psychiatric problems.
Parents are working, right?
Right.
They have to feed their children. So Speaking on some of the other disorders you were mentioning, food, anorexia, bulimia, those are very, very relevant, very, very common.
They're both common and they're increasing. We're
Really?
seeing eating disorders, younger ages, more men. And what many people don't know is our eating disorder patients have the highest risk of suicide of any psychiatric illness. So we have this epidemic of suicide that's increasing, the increasing dramatic rates in 10 to 14-year-old girls, and eating disorders have the highest risk. So it's not just a disorder of will, I'm not want to eat, I'm a little thin, I'm a little overweight. It is a serious psychiatric disorder with a high risk for suicide.
And how about you bringing these insights to the traditional psychiatric societies, realms?
Well,
Do you try? Is there a reception?
We try every day. The good news for me is somehow 15 years ago I ended up in this world of eating disorders where it was much easier for me to talk about malnutrition and brain function to that community than it was for my traditional colleagues in psychiatry who are not quite ready to hear that. So the eating disorder world is a little better in terms of understanding the importance of nutrients and nutrient-dense foods to heal the brain. So the eating disorder community has been receptive, but the medical world is still based on a drug for a symptom, and it's still a lot of work to do.
Are you still using drugs in protocols?
Absolutely. As a psychiatrist seeing very sick patients, I use the term integrative psychiatry. So we use drugs when we need to, but we're always looking at the underlying cause.
So what's the day in the life for you? You were speaking a bit about some of the trainings or oversights on practicing physicians that you're doing. Is that the majority of your time?
Most of my work now is trying to educate young psychiatrists and family doctors and naturopaths that are interested in mental illness. Mm-hmm. So we have courses and we have a fellowship where we work with doctors over a course of a year, because as you know, some of this information takes time to translate the theoretical from the clinical. So our goal is to really educate the younger clinicians, the younger doctors, who seem much more interested than some of my contemporaries about learning this material.
So that's a collaborative care type of design, family medicine, really sharing this face time and
well, most of our family doctors, they prescribe over 80%, certainly of our antidepressants.
Wow.
So primary care docs, OBGYNs, and family practitioners prescribe most of the antidepressants. So patients don't necessarily want to see the psychiatrist.
Yeah.
They're going to their doctor, they're depressed, they're anxious. Mm-hmm. And so our family practitioners, our primary care docs, need to be aware.
So what is the future for you, Dr. Greenblatt, currently? You finished this book rather recently.
Well, I got a long-term plan. Actually, we put it in a book series. So Psychiatry Redefined is our book series. So we've done depression, ADHD, bulimia, Alzheimer's. So we're going to go through the list of major psychiatric disorders. The one we're currently working on is suicide prevention, a biological model for suicide prevention. It's an epidemic that's increasing, and our resources are going into assessment, and nobody's really looking at what's happening in the brain. And I believe that there are very clear biological risk factors like inflammation. We can look at inflammation in the brain, head injury, nutritional deficiencies, and the topic that I speak on a lot, lithium, can actually prevent suicide. And that's the information that we're trying to get out there.
How do you stay sort of in your emotional, well-being to kind of be this source and this guidance to patients, to other professionals in this world? It can't be easy every day.
That's a very good question. And, burnout is too common in the field for those working with trauma and mental illness. So for me, it's really been transitioning from seeing patients and families in the office every day to training clinicians. So that becomes really both inspiring for me and hopeful. So it's less clinical contact, much more supervision and training, and always seeing patients. So I continue to work as a clinician, But over the years, it gets less and less.
Right. And to talk to maybe the new psychiatrists coming into the field, any downloads of wisdom, or if you were looking back, what kind of advice would you maybe share with them moving into this world of combining integrative together?
I think the most important message is, starting off with this concept we've talked about, biochemical individuality, and that don't go to either extreme. Many of my colleagues are either medications for everybody, or the worst is just supplements for everybody, and not kind of understanding that an integrative approach. So there are many supplements that can minimize side effects to medicines, and there are many medicines that can, augment the effects of the supplements. So I think the science is available for young doctors. They need to read the research, get mentored, and take an integrative approach.
Great. And I guess one final thought to summarize, we haven't talked sort of about cognitive therapy, behavioral therapy. Where is your opinion on that field? How do you build that into any of your protocols?
Well, over the years, I was trained as a therapist, family therapist, and that's critical. It's critical for our well-being and our health. I think because of the need, my career has shifted towards that biological look. But what I share with patients and doctors, if we can support the biology and that biological foundation, then they're going to get much more out of therapy. So the need for psychotherapy, cognitive therapy, family therapy, couples therapy, it's kind of that healing glue for many of the disorders that we see. But without a functional biochemistry, it's not going to work.
Walking in the dark a bit.
So the functional medicine, integrative psychiatry approach is kind of the precursor, the first step before, I believe, psychotherapy can be effective.
Interesting. Great. And also, to the point of depression, I feel like there's a lot of classifications to that particular disorder. How would you maybe summarize or define that?
I think, the DSM-5, the Psychiatric Bible, has thousands of names.
Right.
So that's what we do well as a psychiatrist, is just make names up. Doesn't matter what causes them.
Call it, right.
So to me, over the years, names are less important.
Right.
Depression is I believe, a biological phenomena and needs to get treated. There are clearly psychological implications, stress, trauma, grief. But if we can look at the psychological as well as the integrative nutritional approach, oftentimes we can support improvement in mood and prevent some of the tragedies like suicide, which is the end result of untreated depression.
One comment, Dr. Greenblatt, this weekend here at the A4M Spring Congress, we've moved a lot of content into the very complex and quickly changing field of clinical cannabis, CBD. What are your thoughts on CBD, medical marijuana, a lot of semantics around it, in maybe some of the applications of psychiatric mood behavior disorders? Do you have any thoughts?
Sure. As a psychiatrist, I have real concerns about medical marijuana, legalizing marijuana, certainly for our young kids, because I think there's pretty good research looking at higher incidence of psychosis, and what I see a lot is the onset of major psychiatric illness, schizophrenia, bipolar. Not that it was a cause, but a trigger. So, and oftentimes the medical marijuana becomes the self-medication, if you will, for someone who's struggling with severe psychiatric symptoms. So it's been a real struggle for us as adolescent psychiatrists with marijuana or even medical marijuana. The CBD oil we've been using for a number of years for anxiety. So for both insomnia and anxiety, that it's been very helpful, no side effects. So we've been very encouraged. And in the work that I'm doing with anorexia, where young women and men are particularly anxious to eat, they're frightened about eating, we've been looking at starting a research trial using CBD oil for anxiety associated with anorexia.
Great. I think we just skimmed the surface of this very, very deep topic, Dr. Greenblatt, but thank you so much for your time here at the A4M Spring Congress.
My pleasure. It's a great conference, great group.
We look forward to having you back.
Great.
Thank you.
Thank you.